Okay, this video is, does caffeine drop brain blood flow? Caffeine has a very similar chemical structure to adenosine, and caffeine will competitively inhibit the adenosine receptors in the body. Adenosine receptors cause increased blood flow, vasodilation, so caffeine will decrease blood flow. Here's a paper, and the name of the paper is The Effect of Daily Caffeine Use on Cerebral Blood Flow. And here's what it says. You ready for this one? Caffeine reduced cerebral blood flow by an average of 27%. It reduced blood flow to the brain by an average of 27%. That's a lot. In case you remember, I have the Peter Rogers, MD, theory of supply and demand, also called neurovascular uncoupling, about how when you drop the blood flow to the brain, you're dropping the delivery of oxygen and glucose. Okay, and if you drop that too much, brain cells will die by apoptosis. Now you can look at this baseline caffeine. Let's say you drop cerebral blood flow 27%. You superimpose on that psychological stress. Lots of people are stressed out. You're going to drop that blood flow by even more because caffeine raises the same hormones as psychological stress, cortisol and catecholamines. Okay, catecholamines in particular are a big vasoconstrictor. You know, the two of them will increase blood lipids, okay? Elevated blood lipids will decrease oxygen delivery, okay? So that also contributes to decreasing oxygen delivery. High psychological stress, caffeine, sleep deprivation raises the same hormones, by the way, catecholamines and cortisol. Catecholamines are adrenaline and noradrenaline. Well, guess what? When you have elevations in those hormones, you increase vasoconstriction of the gut blood vessels and you increase the risk of leaky gut, increased intestinal permeability. Well, that increases the risk of getting toxins into your blood like bacterial endotoxins, which can also contribute to problems with the blood-brain barrier. Okay, so it's all bad. All right, let's see here. They talked about the mechanism. I talked about that, the A2 adenosine receptors. And they confirmed that everybody was drinking the dose of caffeine they said they were because they were able to measure the amount of caffeine in their salivary glands. When a person stops drinking caffeine after they had been drinking it for a while, they get withdrawal symptoms, headaches, that are due to an increase in cerebral blood flow because the vasoconstrictive effect is relieved. Okay, here's another article on caffeine-induced uncoupling of cerebral blood flow and oxygen metabolism. So they said that, using a brain MRI, a type of brain MRI technique called fMRI, functional MRI, with something called BOLD. BOLD means blood oxygenation level dependent signal. Anyways, the point of it was they compared the difference between the expected cerebral blood flow and what you got after caffeine, and they showed a 35% drop in cerebral blood flow. Okay, it's like, holy crap, between what they thought that tissue needed based on its level of activity and the amount of blood flow it actually got. Okay, that's not good. So you can see that's a pretty big difference. And if you superimpose on that a high-fat meal, you're really dropping your oxygen and glucose delivery. Roy Swank with high-fat meals got a 35% drop in blood flow to the brain of a hamster. Okay. Peter Quo back in the 1950s feeding high-fat meals like with sat fat got 20% drops in oxygen delivery to the tissues from feeding a high-fat meal. So you can see where this is going. Let's say you're stressed out and you're a little sleep deprived and you're drinking caffeine and then you're eating a high-fat meal like a pizza with a lot of sodium on it. Well, bam, you got a lot of vasoconstriction happening. You got vasoconstriction happening from the sodium. You got vasoconstriction happening from the caffeine, from the stress, from the sleep deprivation, it's a stress equivalent. And then you've also got decreased oxygen delivery because of the high fat sticking the red blood cells together, causing rouleau formation, blood sludge. Not good. All these things are going to increase your risk of cognitive decline. You don't want this. And in this study, they took a bunch of stroke patients and they had them drink, just one, good-sized cup of coffee, 250 milligrams of caffeine. The equivalent of a good-sized cup of coffee. They just say caffeine. They don't say coffee here. And then they checked with transcranial Doppler the middle cerebral artery, and they checked it 4 times after that they ingested the caffeine. And what they found was the caffeine caused a significant drop in cerebral blood flow in the middle cerebral artery. That's the most important artery in the brain, by the way, the middle cerebral artery. The carotid comes up and it bifurcates into the anterior and the middle cerebral. Okay, anyways, their conclusion was that since caffeine is present in the diet of most patients who are recovering from a stroke, this is probably a bad idea and may have adverse clinical consequences. You think dropping the cerebral blood flow is going to have a bad effect? Yeah. When you have a stroke, and you have the core of the infarct where the tissue is dead, but you have the adjacent tissue that is called a penumbra. Penumbra means twilight. And the gist of it is the twilight could either become well perfused and return to normal function, or it can get worsening lack of blood supply and it could die, like the core infarct of dead brain in a stroke. So you want to protect that penumbra as best you can. So, drinking caffeine after stroke is stupid. So anyways, this was a couple studies there just to show you how bad caffeine is for blood flow to the brain.